haven't really been happy with my appearance, and I think that's really when it started. I had never really gained weight because I was always playing sports or doing exercise. So once that stopped, I think everything started to catch up with me, and then I got really self conscious. Um, I didn't really have many friends to talk to about the situation because I felt like if I did talk about it, then they would start to notice it more. And they were all pretty skinny, so I didn't feel like they would understand what I was going through. Um, I also started to distance myself from them a lot, so my friendships we kind of started to grow apart, which made the whole situation harder on me because I was by myself all the time, so overthinking usually happened. Um, became really obsessed with getting skinny again and keeping in shape, but I still love food and I couldn't stop eating. And when I did eat, I would eat a big amount of food, and I didn't know how to stop myself from eating. So I ate to the point where I would feel sick, and then that usually led to me getting feeling ashamed of myself. And at first I would just exercise a lot right after I ate because I thought that would make it go away, but I didn't see any changes. So that's when I started to make myself puke, and I puked so much that I often got dizzy. um, Sometimes my parents would ask me about it, and I would just deny it and get really defensive about it. I didn't really want them to worry about me, but the whole situation stressed me out a lot because I'd make myself puke, and then I would feel bad about making myself puke, and I would get angry with myself, which stressed myself out. And I think that the stress also contributed to the disorder because I would stress eat after, and then it'd be a never ending cycle.
Hi, I'm Sydney, Lisa's mom. Lise was diagnosed with bulimia nervosa 2 months ago, and it's been a really big change for our family. Lise has been bulimic for 3 years, and it's taken a huge toll on our family. Lisa's father and I did have our assumptions that she was making herself throw up after she ate large quantities of food around dinner, but she denied it every time, coming up with an excuse why she was sick, either having the flu or what she ate was bugging her stomach. The disorder started roughly around after she stopped playing sports. It became aware to us that she was worried about her body image. We assumed that like every other normal teenager, that was something she would be concerned about. We really started to get worried when Lise would eat large quantities of food and then would disappear off to the bathroom. Her eyes became bloodshot all the time, and her teeth were beginning to become a different color and look very soft because of all the acid of her throwing up. We tried to get Lee's help and to get her to realize what she was doing and how it was affecting our family. But it brought up nothing but fights, and it caused a wedge between Lee's and her father and I. The help from her therapist and the counseling that we did as a family and just for Lee's has started to mend that relationship back. And Lee's is beginning to see how hard it is as a parent to see your daughter put herself through something like that. Hello, I'm Sandra, and I've been Lisa's therapist for the last 2 months. Her parents brought it to my attention that they were worried about Lise and her making herself throw up after she ate. I asked Lise a series of questions, and it was brought to my attention that she had bulimia nervosa. Bulimia nervosa is an emotional disorder involving distortion of body image and an obsessive desire to lose weight, which brings on self-induced vomiting. With Lise, there is food consumed and then the feelings of guilt or shame for eating and what it will do to her body. In deciding on a treatment plan for Lise, it was important for her to be on board and realize the disorder she does have and that she does need help. Once I had Lise on board, it was deciding what treatment plan would be best for her. Psychotherapy, along with family therapy, is the treatment type I decided upon. It is the most common treatment for bulimia and has been researched the most. It is used to help address not only the eating disorder, but also the emotional feelings that accompany the purging. The focus over the next couple months is to focus on the underlying emotional and cognitive issues that occurred before the eating disorder and during the eating disorder. Family therapy is also a very important treatment method for Lise and her family because of the wedge that has been created because of the eating disorder. Family therapy helps Lise see the destructive role she was playing in her family because of the choices she was making. It also lets the family know the role they've been playing in enabling the disorder and help them as a family get back to where they were before the eating disorder started. We are 2 months into the treatment process, and Lise is determined to conquer this disorder and make things right with her family.